my name is Hannah Thompson. I'm your student nurse today. Today we're going to be suctioning and then cleaning up your trach. Can you tell me your name and date of birth? Are you in any pain today on a scale of 0 to 10? And do you have any allergies? Very cool. All right, so I'm going to raise the bed up to my hip height. I'm going to put them in semi-Fowler's or Fowler's position. And I am going to put a pulse ox on their finger. I'm going to also take their lung sounds in a modified Z pattern. Then I'm going to turn on the suction to 100 to 120 millimeters of mercury. I'm going to turn on the oxygen to 100%, put the ambu bag on that. I'm going to have the person sitting up in the semi-Fowler's or Fowler's position. And I'm going to take the collar off of their oxygen, set it on top, so that way they're still breathing, but it's easily removable when I'm doing the procedure. And I am now going to put a drop cloth down in front of them to catch anything that may happen. All right, so the drop cloth is down. I am now going to wash my hands. I am going to put my sterile saline out here. I'm going to wash my hands. I'm going to put on this mask. I do not have a face shield, so the mask and my glasses are what I have right now, but I would put on goggles or a face shield of some type. All right, so now I am going to get this guy. My trach suctioning kit goes right here. I'm going to wash my hands. I'm going to open this without contaminating the inside. Okay, and I am going to grab my sterile gloves out. So I have my sterile gloves on. I'm going to pinch this guy, get rid of that. All done. Okay, I am going to grab the little box out of there. Set that down. I'm going to contaminate this hand and pour some sterile saline into the box. I'm going to take this out. I'm going to wrap it around my hand. I'm now going to take my contaminated hand and attach this to there. Awesome. Okay, I am going to test this out. I'm going to put it in the solution, suction, it worked. We're good to go. I'm going to wrap it back up and I'm going to remove the oxygen from their trach. All right, so I'm going to tell them I'm now going to begin suctioning. I'm going to insert the suction in without having the suction on until they cough or they hit the carina, or I hit the carina. And then I'm going to pull it out 1 inch and I'm going to start to suction intermittently. Awesome. All right. I'm going to take the ambu bag, give them 2 slow breaths that go along with their regular breathing pattern. Put that aside. I'm going to clean this out with some sterile saline. So suction. Do it 1 more time. I'm going to insert until they cough or I hit the carina. I'm going to back it out 1 inch and I'm going to suction intermittently. Okay, and now we are all done with that, so I'm going to wrap this up. I'm going to reattach their own oxygen back on there. And I'm going to clean up. Okay, I'll dispose of all of this properly. I'm going to perform hand hygiene. So now we're going to clean it.